we are going to cover the rest of the anti-amoebicidal drugs. Yesterday we discussed about nitroimidazole groups, metronidazole. So today we are going to talk about other drugs used in. So coming to diloxanide furanate, okay. I told you that metronidazole is an anti-amoebicide which acts only on the liver, not mostly on the intestine. It is not a luminal amoebicide. So one of the important luminal amoebicide is diloxanide furanate. So it is a drug of choice for your intestinal amoebiasis. So it should be combined with your metronidazole, that is tissue amoebicide for extra-intestinal infection. And diloxanide furanate is also your drug of choice for the carriers, those who carry the amoebiasis infection. And main problem with diloxanide furanate is flatulence is a side effect. And coming to next, emitin. Emitin and dihydroemitin, they act by inhibiting the protein synthesis. Okay, and they can be used parenterally, intravenously for your severe hepatic amoebiasis. And because of the toxicity of this drug, they are very rarely used now. So, what are the main toxicity? Since the name starts with emitin, so it can cause more emesis, vomiting, and it can cause your muscle weakness. And main very dangerous side effect is cardiotoxicity. It can cause arrhythmias, it can cause your congestive heart failure. So that's why it is not used now. So important point is the two drugs are in this group, that is emitin and dihydroemitin. How they act by inhibiting the protein synthesis. And how they are given by parenteral route in severe hepatic amoebiasis. And they are not used now because of their toxicity. What are the toxicity they have? They have emesis, they have muscle weakness, and important thing is cardiotoxicity. It can cause arrhythmias and congestive heart failure. That's why they are used very rarely now. And coming to the iodine group of drugs, iodoquinol and quinidochlor, they're also luminal amoebicides like diloxanate furanate. They can also be used for your luminal amoebicide. But in large doses, they can cause thyroid enlargement because they contain iodine. So they will definitely cause thyroid enlargement, and they can also cause peripheral neuropathy. And if you talk about very rare and important side effect, and if you give in high doses, you will get that side effect. That is subacute myelooptic neuropathy. They can damage your eye and can cause subacute myelooptic neuropathy. This is very important regarding your MCQ point of view. If you give iodine in high doses, iodoquinol in high doses, you will get this side effect, subacute myelooptic neuropathy, because they can damage your eye at the high doses. So coming again, iodoquinol is your luminal amoebicides in large doses. They can cause your thyroid enlargement because they contain iodine, and they can also cause peripheral neuropathy. And important side effect, in very high doses, they can damage your eye, causing subacute myelooptic neuropathy. It is called SMON. And another luminal amoebicides we have is perimomycin. Perimomycin is an aminoglycoside like amikacin, cizomycin, natilmycin, streptomycin, such groups. So it is one of the drug used in aminoglycoside. It is the only aminoglycoside which can be given orally, and it is used as your luminal amoebicides. And other indications or other important indications for this drug are it is used as treatment for cryptosporidiosis in AIDS patient, and recently it has been approved for the cutaneous treatment for your Kalaza leishmaniasis. So coming to the paramycin, there are three important uses are there. First thing, it belongs to aminoglycoside family which can be given orally. It is used as luminal amoebicide, and it has some activity against Cryptosporidium parvum in AIDS patient. And recently it has been approved for the cutaneous treatment for your Kala-Azar leishmaniasis. And at last drug we have is nitazoxanide. It is a broad spectrum antiparasite agent. Okay, and nitazoxanide is your product. It is converted into active metabolite called tizoxanide. This tizoxanide will inhibit the enzyme called PFOR, that is pyruvate ferrotoxin oxidoreductase. And this enzyme is essential for energy metabolism in anaerobic organisms, particularly in parasites. So it has good activity against your Cryptosporidium parvum. And it also has activity against Entomoeba histolytica, that is amoebiasis, Trichomonas vaginalis, trichomoniasis, and ascariasis also, and H. nana, and metronidazole resistant giardiasis. Okay, but it is FDA approved only for the two conditions, only for giardiasis and cryptosporidiasis. So it is a broad spectrum anti-parasiticide. So I will tell it again. Nitazoxanide, it is a product. It is converted into active metabolite called digoxinide. The digoxinide will inhibit the enzyme called PFOR, pyruvate ferrodoxin oxidase. This enzyme is responsible for energy metabolism in anaerobic organisms. So it has very good activity against Cryptosporidium parva. And it also has more activity against Entomoeba histolytica amoebiasis, trichomoniasis, ascariasis, H. nana, and metronidazole resistant Giardia species. And FDA, it is approved only for treatment for giardiasis and cryptosporidiasis. And this will finish your entire anti-amoebic drugs. Thank you.